Hi, my name is Allison Ritter, and this week I will be discussing the American healthcare system. So there are three major public health programs that are currently offered in the United States. They are Medicare, Medicaid, and CHIP, which is for the children healthcare. So the first one is just Medicare. As of right now, there are over 553,000 Kansas residents that are currently utilizing the Medicare resources. And at this time, it is also open enrollment. It goes from October to December. And during this time, older adults who qualify for Medicare can enroll for the first time. If you are already enrolled in Medicare, you can also upgrade to either Medicare Advantage or any of the other plans. There are multiple plans out there and just different premiums and different pricing for each one. Something that is new this year that Medicare announced is that 100% of individuals will have a lower premium on their prescription drug coverage, no matter which Medicare plan they choose. And 8 of the plans that are currently out there will also offer lower insulin prices, which is a big step in the Medicare resources and field. The second program is Medicaid. This is for low-income families or SSI recipients. And then by state, it's categorized as categorically needy. And that it does differentiate by state. Something that was actually announced just this past Thursday was President Biden announced that he will be helping people who have previously been locked out of Medicaid. With that, some of the main people that will be getting the extra help that they need are individuals for 12 months after childbirth. So mothers who were previously on Medicaid, say if it was for a condition they had while they were pregnant, they will be able to have Medicaid for the 12 months after that child is born as well. That will benefit many single mothers or low-income families, and is something new that has not been done before. He is also planning on giving disabled individuals more options to stay at their homes. A lot of the times, if you are on Medicaid, it is an automatic that you'll have to go to an assisted care facility or a long-term care facility. And the goal with this is so more people can stay in their homes, stay with where they're comfortable, but have resources come in to help them instead of them having to go somewhere else. However, unlike Medicare, who announced that they would have lower prescription coverage costs, there has still been no decisions made to lower the prescription costs on Medicaid. So the final program is CHIP, which is the Children's Health Insurance Program. This kind of enacted after the Balanced Budgeted Act of 1997. And the goal with this one was to expand coverage for individuals under the age of 19. So there are federal and state matching funds, and much like Medicaid, each state has their own setup plan. Another thing that is very important and that was mentioned in this chapter is gun violence and the healthcare policy. In the past recent years, there has been more gun violence. There has been more suicide, more gun-related deaths in general. And one of the very common talking points in the healthcare field right now is, should gun violence become a healthcare policy? It is a critical issue that needs to be addressed, and it is something that many individuals in the healthcare system believe that they should be having a say on. Many individuals now believe that gun control should be fallen under a public health issue for multiple reasons, one of them being a mental health concern. A lot of these individuals who are participating in gun violence are having some type of mental health issue or episode. And healthcare professionals believe that they should have a say in that, since if it's a mental health issue, they should be at the forefront of it. Another one that many doctors had brought to attention is that there are currently blood shortages everywhere. And if a victim who has been a victim of a shooting, or whether it was accidental or intentional, most of the times, especially if they hit a major organ, they will need a lot of blood. And with these blood shortages, they're running into the issue of not having enough blood to help these victims. And since that is a healthcare issue and a healthcare concern, they believe that they should be participating in the discussion about gun violence. Another public health approach to the gun violence, they mentioned that it is impacted in many different ways, and there's many different ways that gun violence occurs. The top four are homicide, suicide, domestic violence, and unintentional shootings. As of right now, homicide and suicide are at the top two, with domestic violence following closely behind. And in all those, mental health plays a very significant role, and if the victim survives, blood shortages will play a role as well with that public health. The final one is unintentional shootings, which is sadly very common. And they also reported that more than 100 children die each year from unintentional shootings. And with that, with unintentional shootings, there are also many people who are just wounded, but do need medical attention. So that is why many people do believe that gun violence should be linked in with public health, and having physicians and people in the medical field give their opinion on what they could do to protect individuals or help with gun policies, because they believe that with that they would have not only the public's views on it, but the healthcare views on it as well, and what they are seeing day in and day out. Two discussion questions I wanted to ask. The first, why is it important that social workers are up to date with what is going on with the different changes in Medicare and Medicaid that are being made each year? And do you believe that physicians and individuals in the healthcare system should be more involved in the discussion of gun safety and violence, and why or why not? And that is the end of my presentation. Thank you so much.